I guess, Dr. Wolff, sort of take command of your own health if you wish to be healthy. Is that what we're saying?
Absolutely. So one, you reduce your risk, but even when you do that, you still have to what's called be surveyed for cancer. So you have to have screening tests. And the reason why that we do screening tests is that if we find a cancer with a routine screening test, most of the time it's going to be caught so early that the cure rate is so high, and that the therapy needed to treat an early cancer, usually it's much less difficult than to treat a cancer that's far in advanced.
So prevention it plays a very, very significant role in terms of preventing cancer as a disease.
Right, so first we prevent it, but even when we do that, you still may get it.
Okay.
We want to screen you for cancer development and screen you so we can find something so early that the treatment will be very easy. And actually, Beverly is very important in screening for women.
Why don't you say something about that, Ms. Witherspoon?
Well, working in the breast health center, we see a lot of women coming in, not necessarily for a problem in the breast, but a lot of screenings. We do see women just on a yearly basis for their screening mammograms as well.
And I think that you talk about from diagnosis to survivorship. Now, what is the reaction, and perhaps maybe this is not something that you'd like to talk about here, but what is the reaction of individuals who happen to come to you and find out that they've been diagnosed with cancer? I mean, there's a general reaction, I think, and certainly it couldn't be anything that anybody would be pleased with. But is there any kind of remorse, or what? I mean, what?
Well, fear and anxiety is some of the first feelings that these patients have, but just it's always good to have family members with them so they can get some of the information at the same time. Because a lot of times the patient, they leave the clinic without remembering a lot of our recommendations, but we have an excellent support staff, and in our clinics we have excellent nurses, and it's just good to have the whole team involved. And that's the oncologists, the cancer doctors. Sometimes they need a surgery team, and then medical imaging. Just.
Well, what do you say, Dr. Wolff, in reference to some of your patients, for example, who might find out that they've got cancer? I mean, what is your response?
So the saddest patient that I see is somebody who's went through screening, gets found early, but then denies the illness. So I think denial is very important. And what that means is that sometimes the cancer has a chance to grow, to enlarge, and to spread. So it's just like screening. If you deny yourself screening, then you deny yourself the early chance of getting cancer, caught at a very early stage. And if you have cancer, if you deny the need for therapy, then you're going to maybe lower your likelihood of being cured. The issue is not whether we can cure patients. We can cure virtually every patient with cancer nowadays, especially if it's caught at an early stage.
But the whole thing is whether or not they themselves wish to be cured of cancer. Is that what you're saying in a real sense?
I think that happens to a lot of patients, and not just.
And let me interrupt here again for this final commercial break. Dr. Wolff, we'll be back with our audience following this very, very short break.